Good morning, everybody. Welcome to all. In particular, I would like to thank our guests coming from abroad for attending this joint DGD Because Health event. Please do accept my apologies for not being there with you in person. Ladies and gentlemen, let me start with one simple question. Is there any good excuse why people should worry whether the medication they use will work, or on the contrary, make them feel worse or even endanger their lives? Today, more than 1 in 10 medicines in low and middle income countries are of poor quality, putting millions of lives at risk, in particular in already disadvantaged communities. And although in developing countries, medicines account for the second greatest household expenditure, right behind food, more than half of the population in the poorest parts of Africa and Asia lack access to essential medicines. In total, the world loses approximately $30 billion each year because of poor quality medicines harming the health of individuals and eroding public trust in the health system as a whole. Therefore, in order to reach the Sustainable Development Goals, eradicate poverty, which is SDG number 1, and ensure healthy lives, which is SDG number 3, access to quality assured medicines and medical products will be crucial. For one, this means that the Belgian Development Corporation needs to ensure that the 50 million euro we spend every year on the purchase of medicines only goes to purchases of high quality medicines. That is why the Because Health Charter on quality of medicines, which we developed 10 years ago, was such an important milestone. As a result of this charter, Belgium requires the same quality of pharmaceutical products produced in Belgium, whether they are consumed within the EU or exported to countries outside of the European Union. Belgium is one of the only EU countries to do so. As long as this principle is not applied by all EU member states and by other pharmaceutical producing countries, dubious producers can continue abusing consumers in developing countries. But honestly, we need to do more. We need to reinforce the health systems in developing countries in order to improve overall quality of medicines in these countries. By signing the commitment on medicine quality in 2017, Belgium committed itself to the quality of medicines being used in humanitarian and in development programs. And we will keep up NGOs and other actors to this principle, because we really believe that it is important that with public money we make standards and we set the example. The World Health Organization supports our country in this process, and we are really satisfied with the support we are receiving from the World Health Organization. The commitment is innovative and it is inspiring, and it combines a number of elements. First of all, it is a multi-stakeholder involvement, and we are happy to be engaged in that. Secondly, budgeting of quality assurance in programs financed by the DGD is an important element. Third, networking on quality systems and procurement is something we encourage. And fourth, and finally, the capacity building component is something which is for us at the core of this program. Signing the commitment was a first step. Now it is time to act. I'll give you a few examples of where action is needed. First example, capacity building of quality assurance systems, both at the regulatory level and along the supply chain, should become a priority of health system strengthening. Second example, compared to other countries in Africa, Francophone Africa lags behind on medicine quality. They need our specific attention. Third example, public-private partnerships offer a lot of potential for quick wins. For example, when it comes to fighting trafficking of falsified medicines. Next example, humanitarian actors are disbursing more and more cash. While giving cash is clearly to be encouraged, humanitarian actors should also address the quality of the medicines bought with these cash allowances. Last but not least, the commitment Belgium signed should serve as an example for other donors. If more donors join in requiring quality assured products, they will create a market incentive that will lead to broader availability and lower prices of quality medication. Joint or even harmonized requirements and monitoring and evaluation between several donors will reduce the workload of actors in the field dealing with pharmaceutical procurement. In conclusion, to tackle today's biggest global health challenge and to have an impact on the lives of millions of people worldwide, we need to get engaged. We need to get more financing. We need joint and strategic actions. Have a fruitful seminar. Its work and recommendations will be extremely useful in implementing the Belgian commitment.